I was diagnosed type 2 diabetic in 2013, and at one point, every toe on both legs had a wound on it because just, I just didn't take care of them. Well, a little over a year ago, I was in bed, and I went to swing out of bed, and my feet just kept going and slid on the floor, and I fell out of the bed. Being unable to get back up, I laid on the floor for a couple hours before I was able to kind of crawl over to a wallway that was abutting my neighbor's wall, and I just pounded on the wall, and then she realized, something's going on. She was able to get in and saw me on the floor and called the ambulance, and as they're picking me up, he said, Mr. Ingwer, this leg looks really, really bad, so I think you should go to the hospital. And I wasn't in a position to argue with him, so I went to the hospital.
Joseph is a wonderful patient of mine. It was a pleasure to take care of him. I met him in the hospital. Actually, he had a very bad infection of his lower extremity, which unfortunately the only thing to save his life to do was amputation. I, of course, cryobladed during the case. He did very well post-operatively. He's got a wonderful outlook on life. He's already, got himself pushed to rehab. He was very involved with his care. In my experience with AtriCure and with Cryo Nerve Block, I tell my patients, I don't expect this to hurt very much because I'm going to do this for you. My patients respond very well to the ablation. I mean, they wake up and they are surprised themselves, right? They're expecting this to hurt a lot, and they wake up and it feels relatively numb. They have kind of minimal surgical pain.
I thought it'd be much more painful than it was. I just expected it to be really sore, and it really wasn't. I mean, the first couple of days they gave me morphine, and after that I said, I don't want morphine anymore. Just give me Tylenol. And that's what I took for the remainder of the 2 weeks I was there. And I remember the nurses coming in and saying, well, on a scale of 1 to 10, I would tell them, at 1 maybe. I can't imagine if I had to go through what I'm going now, and then also have to deal with a pain issue. I'm glad there's several things we have to deal with this, and if I can eliminate one of them, boy, that's worth doing.
But if their pain is well controlled, you get them to rehab very quickly, which is fantastic. They're not in the hospital for 7 days because of horrific pain. They're up and mobilizing faster because they don't have much pain. They get to rehab faster. Some of my patients nowadays, after I started Cryo Nerve Block, that's a day, maybe 2, till they start rehab. Prior to my use of the cryoablation probe, people stay for a week. They stay for a week in the hospital. It delays them a week to start rehab. When you get a jump start on rehab, it makes a world of a difference.
So the process has been wheelchair, 2-wheeled walker, rollator, which is a 4-wheel walker, and now they wanted me to start crutches, but I've already been doing crutches for about 3 weeks now. I just get around my little complex I live in, and I'm doing that. Take my neighbor's dog out, which I was doing for a year or so before. I'm not going to run a marathon, or I'm not planning to do anything elaborate, so a lot of the goals I had already set to accomplish, I've done. Now my ultimate goal now is to get down so I can walk without any attachment other than maybe a cane. I thought the pain would be something I'd be dealing with for quite a while, and I don't even have a bottle of aspirin or Tylenol in the apartment now because I just don't use it. If I can do it, you can do it.
By controlling their pain post-operatively, it really turns their kind of psyche to the point where I've lost my leg, but I can do this. It doesn't hurt that much. I can rehab. I can do this. It gives them a motivation to participate in care. And if they didn't have pain control, they would not do that. They can't do it.